afternoon, and thank you for joining us for Ask a Doc, presented by Broward Health in partnership with Gilda's Club of South Florida. I'm Gina Barroso, your moderator for today's chat. And did you know that breast cancer is the second leading cause of death among women? Every 2 minutes, a woman is diagnosed with breast cancer in the United States. The good news is there are over 3.5 million breast cancer survivors in this country. Today, we'll learn about symptoms, treatments, and resources available with the help of our two guests. Our first speaker is Dr. Mehmet Hepgur. He is a hematologist-oncologist with the Broward Health Physician Group. Dr. Hepgur practices out of the Cancer Center at Broward Health North in Deerfield Beach and serves as an assistant professor of medicine at Nova Southeastern University's College of Medicine. Thank you, doctor, for being here.
Thank you very much for having me.
Our other panelist is Belinda Paulicin, Program Director at Gilda's Club of South Florida, a center dedicated to providing support and resources for those living with cancer, as well as for their friends and family. Belinda also works with women of color to raise awareness about breast health. Belinda, thank you for being a part of this conversation.
Thank you for having me, and I'm glad to be here.
And for everyone following along on Facebook, we want to hear from you. You can submit your questions in the comment section right here below. And I think we should just get started with a few questions that were shared in advance. Doctor, this one's for you. Let's start with the basics. What is breast cancer?
So first of all, I would like to speak about the function of the breast. Breast, essentially the organ that produces milk, and it basically has glands, and those glands run from tiny glands with ducts, and they connect together, and essentially they end up in the nipple. And the breast has connective tissue, some fat, skin, and muscle. And any uncontrolled growth from these tissues is called malignant, and these are abnormal, and it essentially forms breast cancer.
This one is also for you. What are some of the causes and risk factors of breast cancer?
So basically, multiple risk factors. Some of the risk factors are associated with lifestyle changes, or some of the risk factors are structural. For example, prolonged exposure to estrogen is basically that's the main hormone in females, increased risk factor for breast cancer. For example, not having children, having children in the late age, being obese or overweight, or having late menopause essentially increase the risk of being exposed to estrogen and breast cancer. Plus, there are some genetic factors associated with that. Let's say if you have a family member who has breast cancer, especially in your first-degree relatives, if you are advanced in age, if you're older, this is also a risk factor. Plus, in the early days, we used to give radiation patients with lymphoma in the past, especially younger women, and those women actually had increased risk for breast cancer. That's also another risk factor. Like I said, lifestyle, excessive alcohol use, or being obese, another risk factor for breast cancer.
And what should we be looking for in our bodies? What are some of the symptoms?
So there are actually multiple symptoms associated with the breast. In general, any change in the breast tissue has to be taken into account. Essentially, I recommend the women to be aware of their own breasts and how they look like. As I said, the breast has skin and nipple and the areola. So any change in this area, for example, a dimpling, drainage, warmth, redness, any unusual pain, a lump, these are the symptoms that can actually resemble a breast cancer. And if you essentially feel something like that, you have to notify your physician immediately.
So if I'm one of the women that are watching us now on Facebook Live, and I've checked off all of those items that you have said, and I am not at risk for any of those reasons, so why should I get checked out?
Because if you look at the breast cancer outcomes, the outcomes of early stage breast cancer and late stage breast cancer is significantly different. if you diagnose a breast cancer at the stage 1 level, the survival in 5 years is close to 99%. However, if you diagnose a patient at stage 4, which is the latest stage, then 5-year survival goes down to 15-20%. So there's a significant difference in terms of outcomes. So in order to cure our patients with breast cancer, we have to diagnose very early. And note that 1 in 8 women will develop breast cancer in their lifetime. This is a very common condition. So for this reason, it is actually a big public health issue. For this reason, we do recommend early recognition. So early recognition, we're going to discuss, can be done by like early noticing the symptoms or even without having any symptoms.
Well, it's interesting that, you should be talking about numbers and getting diagnosed early, because one of the problems that we're seeing in the middle of this pandemic that we're in is that cancer screenings are down about 30 to 40%. And what does that tell you? What is it going to look like, 3 years from now when we look back? People are not going for their checkups.
Yeah, unfortunately, cancer doesn't stop. The cancer incidence in the United States hasn't changed. So for this reason, going to the doctor's office or not being checked because of a COVID fear doesn't necessarily mean that you don't have any risk for breast cancer. So we will obviously see the outcomes and how the patients will look like within the next few years, because I agree with you, there are significant decline in numbers that we diagnose right now.
According to the National Breast Cancer Foundation, an estimated 276,000 women will be diagnosed in 2020 with invasive breast cancer in the United States. And as you said, Doctor, 1 in 8 women will develop breast cancer in their lifetime. Dr. Hepgur, what do the treatment options look like? Which ones are, giving you hope about successful outcomes? Let's just put a little bit of good news out there.
Treatment options differ based on the stage of the patient. So I'm talking about early stage patient. I'm not talking about late stage patients. Early stage patient, I'm talking about stage 1, 2, and 3. This is a localized or locally advanced breast cancers. So basically, we apply a multidisciplinary approach. So the treatment starts from the X-rays, the imaging, ultrasound, pathology, and then we identify the patient stage and the pathological stage and plan for treatment. Not all breast cancers are the same. Some breast cancers are sensitive to hormone therapy. Some breast cancers are sensitive to chemotherapy. Some breast cancers actually benefit from target therapy such as trastuzumab. So what we essentially do when we see a new patient, we have a multidisciplinary team that includes a radiation oncologist, a pathologist, a surgeon, and a medical oncologist. And depending on the patient stage, we determine whether we should do surgery up front or do chemotherapy up front, shrink the tumor, and then surgery after that, and give radiation following surgery to prevent the cancer coming back in the future. And again, if the patient has a hormone receptor positive disease, we give hormone therapy for almost 10 years. And after the patient's initial treatment is completed, we continue to follow up on the patient, and we also address the issues that can arise associated with treatment. For example, bone loss is a problem with the women patient. Actually, it can really affect the outcomes and the patient's, quality of life. These are the things that we also address. But what I can tell you is that with this personalized and combined approach, our success rate is almost 99% in 5 years as far as survival is concerned.
It's wonderful to hear you, talk to us about what it's like now to have breast cancer, survive breast cancer. And our other guest, Belinda Paulicin, has been patiently waiting to join the conversation here. And it's perfect. It's a perfect connection between what the doctor just said and what we're going to talk about now, right? Which is Gilda's Club, named after a woman that you will tell us about, who many of us know. And it wasn't like that many years ago. Not only did they not have the treatments that are available now, but they didn't have a Gilda's Club. So thank you for being with us and enlighten us a little bit.
Thank you, Gina. Yes, Gilda Radner, as you said, is a famous and well-known comedian, and she, many people know her from Saturday Night Live. And she developed ovarian cancer, and one of her dreams was to develop a community where anyone with cancer would receive the type of support she found while living with the disease. And so it was really her mission to bring that kind of support at the community level. So in 1997, Gilda's Club South Florida was founded by two families in memories of their daughter to provide care in the South Florida area. It's clear that our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And so we provide 5 core components to our programming: support services, support groups, individual counseling, educational programs that focuses on cancer diagnosis, but also education in the community for prevention, risk, and really a lot of what Dr. Hepgur is saying about the importance of screening. We have our healthy living styles. Again, just as Dr. Hepgur was saying about the importance of maintaining that healthy lifestyle, whether before, during, or in your survivorship of cancer. So we offer diet, nutrition, exercise, and yoga classes. We have our social events just to really make an impact in reducing isolation, and our linkages to referral and services. So we want to make sure that there are those barriers to access to good things like screening and good care is accessible.
And Belinda, you also work with women of color. Why is it important for them to know about advocating for their own health?
Right, and this is so perfect to, again, what Dr. Hepgur was saying about early detection is very important. And so the Women of Color initiative is to bring information to the community about the importance of early detection. So we focus on 4 key areas of learning, knowing your risk. Again, just as what we were talking about today, knowing your family history, knowing that and sharing that with your healthcare provider, getting screened, very important, knowing what's normal for you. As the doctor is saying, if something comes up that is abnormal or feels different in your body, being able to be comfortable to speak up and get the help and care for it. And then making those healthy lifestyle choices so we can start seeing some of those disparity issues be addressed as well.
Belinda, it's great to see how Gilda's Club expands access to support all women. And thank you so much for what you and your team are doing. Dr. Hepgur, if you could add to what Belinda said, how does Broward Health approach the treatment of breast cancer?
So we approach breast cancer in a multidisciplinary way. First of all, when we have a new patient consultation, we assess the patient from multiple angles, because this is not just a medical issue, this is also a social issue. The patient may have some issues with their general life and family and some other preferences, so we address those as well. But first of all, from medical perspective, we get together with our multidisciplinary team and we essentially look at the patient's pathology, and essentially with that pathology, we order some additional testing to identify what exactly we can do. Because breast cancer in 2020 is highly personalized. Not all breast cancers are the same. And I'm talking about all cancers starting from stage 1 to stage 4. Some of them benefit from hormone therapy, some of them benefit from chemotherapy, some of them benefit from immunotherapy, which is a new treatment that we actually utilize in stage 4 patients. So for this reason, what we do, we essentially send next generation sequencing, which is the DNA test, looking at the mutation to see if the patient would benefit from certain drugs, which other breast cancer may not benefit. We address those. And then again, after we do our treatment planning, we discuss the case with the surgeon and the radiation oncologist, and we come up with a multidisciplinary plan. Again, this is a highly specialized and highly sophisticated plan, and it's very hard for me to explain that in 5 minutes. But again, we basically use all the current NCCN guidelines, and we basically use all the cutting edge techniques, and pretty much we can use all the agents which has been basically authorized by FDA. Plus, we have a clinical trial program. I'm running the clinical trial program. We have clinical trials for treatment or some other prevention methods. We also offer those clinical trials for the patient if they're agreeable. We also have some tissue collection programs in an effort to find a new, basically targets for other cancer or breast cancer in the future. So essentially, that's how we address the patients, and pretty much our outcomes are good. That's basically it. Yeah.
So can you tell us about the next frontier with breast cancer treatment? Since you're at the cusp of it and you know what's coming from the pipeline.
So like I said, we are 99% successful in terms of 5-year survival. We want to make it 100%. Again, the biggest issue in early breast cancer, because the approach to early breast cancer and late stage breast cancer is very different. But the most important thing is actually you address all these issues. And like Belinda mentioned, social issues and access to healthcare is the key. And actually having an institution like Gilda's Club, for example, is very important. I had patients I have seen in the past, they had ulcerated mass in their breast for 2 years. They haven't even seen a doctor, or they did not haven't even bothered themselves to basically mention to anybody because they were embarrassed. I mean, they couldn't even tell about that because obviously nobody wants her breast to be seen by a random person. So having the institution like, for example, Gilda's Club, or basically giving the patients more awareness about the situation will make them promptly go to the physician, because a woman can see an ulcer in her breast and it may feel like it's an eczema, but it's not an eczema, it's actually the breast cancer. So actually we have a big role in the community to educate people in terms of early detection. So with the early detection methods, we can identify breast cancers even they're in millimetric sizes, not even becoming, centimeters. So if you identify breast cancer like that, likelihood of coming back in the future or recurrence is very, very small. So that is the reason, we're trying to, address those issues and make it better. In terms of stage 4 cancers, in the past, 10 years ago, we were only limited to some hormone therapies and some chemotherapies. But now we have some new treatment methods. For example, we have combinations that we can use with hormone therapy. We actually combine hormone therapy with some new agents, and we prevent the cancer to develop resistance to therapy. There's about one beautiful treatment, and I have stage 4 cancers. Although that's not a typical response, they clear their cancer all day stage 4 with those options. Or we have immunotherapy option. If a patient has a PD-L1, we combine immunotherapy with chemotherapy. Again, many patients benefit from that. There are new agents actually coming from the pipeline. There's a recent treatment approved by FDA that is a conjugate drug. So this is a very exciting drug. So the drug has an antibody conjugated with a chemotherapy agent. So what it does, it essentially attacks the cancer through the membrane, and it enters the to the member like a Trojan horse, if you will. So basically, the antibody helps the drug to enter the cell, and then it releases the cancer therapy inside the cell and actually destroy the cell. So these are very, very exciting developments. So for this reason, even our patients have stage 4, we give them hope and several options for treatment.
Doc, I love the passion with which you talk about, treating your patients and the excitement in your voice, knowing that this disease will be, better dealt with soon in the very near future. And I know that the folk at Gilda's Club are just as passionate and committed to the community. What are you doing currently to get people to go get checked out because of the pandemic, and the information that you have at hand that we're looking at 30 to 40%? Those are big numbers. Belinda.
So at Gilda's Club, we tell them this, and everyone in the community when we're doing our educational presentation, is definitely to go see your doctor on a regular basis. The biggest thing you can do, especially a woman, over the age of 40, 45, is to continue those annual mammograms and don't skip it. We also recommend that you speak to your provider about safety measures as outlined in the Center for Disease and Control and Prevention for hospitals and your doctor's office. Just like they're doing at Broward Health, it's important to follow your doctor's advice for breast screening. it's difficult during these times, and I know it can be scary, but the reality is that, as the doctor said, cancer doesn't go away. So early detection, getting those screenings are very important.
Anything you want to add to that, Doc?
So, basically, in addition to educating the patients, we also educate the physicians as well, because physician also has to be educated. One of the key aspects of breast cancer prevention is also asking the patient's family history and what's going on with the family. I'm a hematologist-oncologist, so I see patients all across the board. I mean, I have patients with iron deficiency anemia all the way to stage 4 breast cancer. But I remember a patient, comes to my office, a young woman in her 30s with iron deficiency anemia, and I obviously asked for her cancer history, although this wasn't within the topic of that visit and that day. And it turns out that patient had an extensive breast cancer history in the family, her mother and sister, and one of the maternal onset breast cancer. And I basically started on this patient some genetic testing. It turns out the patient had a BRCA. So, and then patient was properly followed up, and we prevented a breast cancer that may arise from a mutation. So for this reason, we try to educate the primary care physician as well. And we asked them to update the patient's family history, because you may see a patient as a primary care physician 10 years ago with some sort of family history, but that family history is dynamic, is going to change within the next 10 years. So if you don't ask the patient, and then if you stick with the family history like 10 years ago, many things may have changed and you're not even aware of that. And all of a sudden you end up with a breast cancer out of nowhere. But it turns out that the patient's, mother had a breast cancer at the age of 45, for example, during that course, and so forth. So that's the reason we try to educate physicians.
Thank you, Dr. Hepgur. That's very, very reassuring. And of course, I know firsthand too the extraordinary steps that Broward Health is taking, because I am over at Broward Health Imperial Point. And I see the care with which we take with our patients, and the help that we provide to their families and friends. I am looking here at some questions that we've been receiving, and here's one. It says, this one is coming from Tasha, and it says, I've recently been diagnosed with breast cancer. I'm feeling all alone. How can Gilda's Club help me?
Gilda's Club is here to provide the support through psychosocial support groups, individual counseling. So anyone who calls that office at 954-763-6776 or sends us an email at info@gildasclubsouthflorida.org will have an opportunity to talk to one of our social workers, where we kind of get to know you and know your individual needs and help you with identifying a support group that we can offer, so that, we have shown that attending support groups has been very helpful in getting information, but also reducing loneliness and isolation. And especially during this time of COVID, it's important to stay connected. So reach out. There's information. We have experts such as Dr. Hepgur and other experts who come in and speak. And so there's that information, there's that community that's here to support you.
Thank you, Belinda. Here's another question. This is from Marie for Dr. Hepgur. It says, many of us are aware that breast cancer can be inherited. What are some genetic risk factors, and what can we do about them?
So genetic risk factors, basically, there are various genetic risk factors. For example, if one of your first relatives had a breast cancer before the age of 45, then you're a risk factor. This is a genetic risk factor. If you have a male breast cancer in the family member, is another risk factor. If you have 2 first-degree members, mother or sister, had breast cancer, that's one other factor for breast cancer. So if you have a family member who has been diagnosed with BRCA mutation, which is the most common mutation, you have to be tested. Plus, if you have an Ashkenazi Jewish descent, you have essentially a risk for breast cancer. So what I suggest, if you have basically those kind of risk factors, you have to bring it up to your primary care physician. Plus, there are some other cancer gene syndromes not limited to breast cancers. For example, let's say if you have a family history of colon cancer and endometrial cancer or ovarian cancer, these are also, risk factors for other gene mutations, which is associated with breast cancer, because the most common is BRCA mutation. So for this reason, my recommendation is to bring all these, issues, that is especially family history. If you have especially family history, bring it up to your primary care physician, and he can analyze and then, refer to the right person. In Broward Health, we have a genetic counselor. I can also order additional genetic testing based on the patient's risk factors and identify those mutations.
It's even though there's so much out there that can help us find out if we are predisposed to these factors, it's a scary step sometimes just to take that initiative and go and say, okay, I want to be tested for the BRCA. I mean, I'll share personally, I have had breast cancer in my family, uterine, ovarian, all of them with immediate family. And, I remember when I asked my doctor, can I, have this test? And, one of the questions is, well, and if it comes back positive, what are you going to do about it? So everything opens up yet another door. And taking that first step is very important. So I know you said earlier, some people are just embarrassed. Some people are embarrassed to say that they have cancer. And is some of the stigma, right, that comes to the equation, which brings me to the question to you, Belinda. How do you see that in the minority communities that you work with, that stigma of people, even out of fear, they don't want to comment that they're sick and they don't get the emotional support?
Yes. Unfortunately, yes, that is the case. Folks used to think about cancer and it was just this horrible, and it meant, that's the worst thing possible. And so sometimes wanting to avoid that. And then what will other people think, and how the treatment and how I will change my life. And so one of the things that is great about belonging to a community is getting together with other folks who give you that voice, who help you be able to talk to individuals in the family, and also the strength of the community in supporting one another is because knowing about your cancer and feeling empowered will make you feel more in control. So one of the things that we try to do is really try to reduce the stigma through education. We have our Kids Can program where we go into the schools and we provide, cancer awareness education. Really, it starts with us and in society, in the community, as well as joining in with the individuals impacted by cancer.
Thank you for that. Those were words of wisdom for sure. Parting advice, Dr. Hepgur, last sentence takeaway for those that joined us.
So the takeaway is that it's very important to identify breast cancer early stage. So that's the reason we have to utilize all our resources in the medical community to achieve that, because outcomes are significantly different. But again, even if you're diagnosed with breast cancer, there's a lot of hope. So diagnosing with breast cancer is not the end of the road. And again, outcomes are very good. Even if you're late stage, there is a lot of hope. So for this reason, my recommendations for the patients, to seek for healthcare. Don't get embarrassed. Just seek for healthcare, and doctors will help you to get rid of this big problem.
So this has certainly been an informative discussion. Ladies, let's take care of our bodies and schedule our visits and diagnostic tests like our mammograms. October is designated as Breast Cancer Awareness Month to give us a reason to care for ourselves. I want to thank our two panelists, Dr. Hepgur and Belinda Paulicin. Give them some love in the comments. Dr. Mehmet Hepgur is a hematologist-oncologist with the Broward Health Physician Group. How can patients get in touch with you, Doc?
So my office is located at Cancer Center at North Broward. The address is 201 East Sample Road, Deerfield Beach. The phone number is 954-786-7304 and 954-786-6460. If they call us from these numbers, we'll be more than happy to see them.
Thank you, Doctor. Thank you so much, Doctor. As Program Director for Gilda's Club of South Florida, Belinda has over 25 years of experience developing trauma-focused interventions and advocating for children and families. And how do they reach you? I know you mentioned it earlier, but maybe people weren't quite ready.
Sure. 954-763-6776 is our telephone number. That's 954-763-6776. You can also send us an email at info@gildasclubsouthflorida, one word, .org, or visit our website at www.gildasclubsouthflorida.org.
Thanks to you both. Again, this was a lot of fun. If you have a health concern, Broward Health's Nurse Connect is just a call away. Nurse Connect has registered nurses available 24 hours a day, 7 days a week for general medical questions, and they can schedule appointments. Simply call 954-320-5730. We'll also leave the number in the comments. If you're experiencing an emergency, we do ask that you please not hesitate and call 911. We'll say goodbye to this edition and be well and see you next time. Thank you all.